Testing, testing.
Prof, maybe we can do music. Good afternoon, ladies and gentlemen. A very good welcome to all of you to this afternoon brown bag talk on Sarawak COVID-19 vaccination campaign organized by Sarawak Development Institute and supported by New Dimension through Conference X. For everyone's information, SDI's brown bag series is an informal sharing sessions by SDI members on pertinent current issues and concerns. Today we have a very special editions of Brown Bag Talk because we have three speakers. Our first speaker is Yang Berbahagia Professor Datu Dr. Andrew Kiyu, Professor of Public Health at UNIMAS, and he is also the chairman of the Sarawak COVID-19 Vaccine Advisory Group, SCOVAC, under SDMC. He will share on the types of COVID-19 vaccine, safety and efficacy of the vaccines. Our second speaker is Dr. Radziah Mohamad, Public Health Specialist and Principal Assistant Director of Public Health Development Sections from Sarawak State Health Department. She will share on Sarawak COVID-19 vaccination plan. Last but not least, Haji Aziman Wadi, Principal Assistant Director of Health Promotion Sections from Sarawak State Health Department. He will talk on the communication strategies for the COVID-19 vaccination plan rollout. Now, I would like just to go through a very brief housekeeping rules to ensure a smooth sessions for everyone. First, please mute your microphone when the session is ongoing to avoid any distraction. Second is please use the chat function to raise questions during the presentation sessions and during the Q&A sessions as well if you want to. We will compile and highlight the questions to the speakers during the Q&A sessions. And if you want to ask the questions live or during the Q&A sessions, you can use the raise hand button next to your name under the participant list. Then you can, we will highlight you to ask the questions verbally. So now let us start the talk by conducting a short poll. We will have three polls during this talk. So the first sections of the poll, we will have three questions. So let's turn on the polls. So the first question is, have you been vaccinated? We will give a few minutes. Oh, no, a few minutes, a few seconds. Okay, so majority of the participants has yet to be vaccinated. Great. So we do have a few that has been vaccinated. Just maybe give another more. Okay, I think roughly. Okay, so we have about more than 81% has yet to be vaccinated, and 19% has been vaccinated. Okay, the second question. Okay, the second question is, are you worried about the side effect of COVID-19 vaccine? So we have about 70 plus worried, yes, worried about the side effects of COVID-19 vaccine. 73% said yes, worried about the side effects. Okay, the last questions for these sections is next one. Okay, do you know what the side effects are? This is quite balanced. Wow, okay, about 51 say yes. Okay, 51 say yes and 49 say no. All right, Dato? All right, now thank you everyone for your participations. Now, without further ado, I would like to invite Yang Berbahagia Professor Dr. Andrew to start his presentations. Over to you, Prof. You have 30 minutes for your presentations.
Can you all hear me?
Yes. Yes, Dr. Great.
Okay, let me share my screen. I still have this poll in front of me. Oh, okay, gone already. Okay, I would like to thank SDI for organizing this, and also to all of you who are joining this session. I know there are many such talks on the internet. Some of them I would say they are genuine. Some of them I would say that they are giving either misinformation or disinformation. So what we are going to do here is to update you people, I mean the listeners, on COVID-19 vaccine, especially in the context of Sarawak. So what I'm going to do is to not go straight into the vaccines, but to look at how we are going to manage or end this COVID-19 pandemic. Globally pandemic, and locally it will be an epidemic or an outbreak. So there are two goals of managing this COVID-19 pandemic. The first goal is the socio-economic one. This is when social and economic life gets back to its pre-pandemic condition. And how do we know we have reached this goal? We know that we will reach this goal when schools and businesses reopen fully, when we can go back on the plane again, and so on and so on. But I'm not going to talk about this part of the COVID-19 pandemic endpoint. What I'm going to focus on instead will be on the medical part. This is when the medical and health services get back to pre-pandemic conditions. Now, the health system is overloaded by COVID-19, either in the form of patients filling up beds or filling up ICU and filling up the ventilator spaces and so on. So under the medical component of it, there are two possibilities. The first one, which happens with SARS-1. Remember in 2003, we had SARS. The virus was eliminated in the sense that after it disappeared, we cannot find it anymore. So this is what we mean by elimination. And so if that happens with COVID-19, the COVID-19 transmission would have ended, and there would not have been any new case of COVID-19. But the world have failed with this. So it's not going to be eliminated. Instead, what it looks like is that COVID-19 will become endemic. So once it becomes endemic, this means that it's present, always present in a particular area. It may be present in very high numbers or in low numbers. And so what happens when we reach that kind of situation is that we try to minimize the number of new cases to low or manageable levels. And the other one, of course, is to reduce the number of severe cases so that we will have less deaths and less use of ICUs and ventilators and so on. And while all this is going on, of course, endemic, low level, we can deal with it, but it can also, we have to prevent outbreaks and epidemics. We have not reached this goal yet because we have not controlled these first two parts here. So we are still somewhere here, okay, in the progression of the outbreak of the pandemic. And so we have, as I mentioned just now, the first one, if we go to this, the first thing that happens, where is the first intervention point that was possible? The world, globally, we have failed to prevent this. We have failed to eliminate the virus. Okay, and there are many reasons for this. You see, the SARS-CoV-2, which is the virus that caused COVID-19, is what we call an emerging infectious disease. It comes from animals, and from bats, it goes somewhere through animals, maybe through the live animal market, it goes to humans, and from there it became outbreak, quickly became an epidemic, and from there it became a pandemic. And the reason that it became a pandemic very, very quickly is that because, of course, the virus has quite high, what we call transmission potential. And the other reasons, of course, that is the reason from the virus point of view, but from the human point of view, what happens is that national pride have prevented the world being alerted to it in the first place. The other one is what we call hubris, because many countries feel that it won't happen to my country, it happens to some other country, and so on. And even though there were warning signs, for instance, the European Union, they have done their risk analysis, and it looks like the virus is going to go to Europe and to the US. They did not take action because I think part of the reason is hubris. You think that it will not affect you. And the third one that it happened was infodemic of disinformation. This is different from misinformation. Misinformation, it can be because people don't understand things and so on. But disinformation is a deliberate attempt to give wrong information. And all this lead to this, what Yuval Noah have called trust issues. People don't trust in science. They think that, for instance, that this is a make-up disease, there is no pandemic. In fact, even today, some people are still showing things that there is no pandemic at all, and not realizing that literally millions of people have died from this virus in globally, and here in Sarawak, we have many deaths. And of course, there was trust issues with public authorities, and especially in the US during the time of Trump, for instance. And once you lose this public trust, it's very important, very difficult to get this trust back. And so you cannot lose this public trust, because once you get it, the control and the other things that the public authorities will want to do will the public will automatically turn the other way 180 degrees. And the other one is the media. So the media must also be trustworthy and so on. So all these things have led to where the world is now. Of course, the virus is there, but all these human issues have made it into a pandemic. So there were various points where we could have prevented a pandemic, but all that were past already, and now we are here, and we are in the many countries are trying to do containment. For instance, in countries like Australia, New Zealand, where there are few cases, they want to contain it, they want it to get out. Whereas other countries are doing mitigation already. They think that it is impossible to contain it. So you try and minimize the effects and so on. And of course, the end will be global catastrophic biological risk in which humans will be eliminated. I don't think we will reach this is part of science fiction where zombies will take over and humans will disappear. So this part will not be there. But still, it's a sad story that we have, the humans as a whole have failed all this until we are now at this global pandemic. Okay. So that's all I'm going to say about this, because time is limited. But now that it becomes endemic, how are we going to reduce the number of new cases such that it will be down to, because it's very difficult to get to zero, so we need to get it down to manageable levels. Okay. And how do we reduce transmission? Basically, what we had before vaccines come was what the health authorities call non-pharmaceutical interventions. And we are very familiar with these social distancing, masks. And when you visit even your grandparents or your parents, you will only see them either through plastic or through glass like this. And so that's the non-pharmaceutical intervention. And if you think about it, there are two groups of non-pharmaceutical intervention. It's like a Swiss cheese. None of them is perfect. Each one of them have holes. But when you put them all together, it's very difficult for the virus and to pass through all the holes together, okay? So the first set of NPIs, the non-pharmaceutical interventions, look at personal responsibilities, physical distancing, wearing of masks, hand hygiene, avoiding touching your face because your mucosa is there, and then you limit your time when things are crowded. And then there are shared responsibilities, which is a responsibility of society to, to do fast and sensitive testing and contact tracing, maintaining proper ventilation. In fact, free air ventilation is better than aircon ventilation. The government messaging and financial support, the quarantine, and the latest one is the vaccine. So this is the way we do so that we have less spread of the disease. Okay, and this is a clearer model of how the Swiss cheese model work because all have holes, and if you stack them together, then you will be protected. Okay, and that's the idea that we have in mind. And then the next one is to reduce the number of severe cases. Uh, so, so the thing to do that is to find, trace, test, trace, isolate, and support cases so that we can detect cases early. And if there are severe symptoms of severe disease, they can be treated early and so on before it's too late. So you can imagine that in the case of Cebu, for instance, during the early phase of this year, there were some patients who were brought in dead even to a hospital and so on. So that means that the testing, the tracing, the isolation of the patients and so on was not very successful. But it's like a board game of snakes and ladders because there are so many things that can happen here, from getting the correct supplies of the testing kit to the test being available to whether they're reaching the lab, they have enough capacity or not, and then capacity for contact tracing, and then the capacity to isolate the contacts. And you can imagine, like us, it's very difficult for us to have enough quarantine facilities for in the hotels, and because we need to quarantine the close contacts, we realize that quarantining people at home is very, very difficult, especially when in our kind of home, people don't have their own rooms, they don't have separate toilets, and so on. And you can see that there are many things that can bring us back to the snake will swallow us. For instance, if there is no monitoring, isolation, we'll be back to here testing. If there is inadequate isolation facilities, we'll also be back here. They will set us back. And the things that will promote us, will bring us better is the test site and so on. Then it will reach the sample. And there are very few ladders actually that will make us move. A lot of it is snakes that will swallow you and so on. This shows how difficult it is to manage all this because the logistics and getting the supplies, especially last time in early last year and even this year, the testing kits are very difficult to get and it is not cheap. Because just imagine one test minimum is about 250, you know. So if you test 4 people, it's already 1,000. You imagine how much the state and the country is spending on this and the quarantine facilities and so on. So it is a big challenge, okay? And the next thing I want to go to after we have tried and reduce the number of severe cases is how do we reduce deaths? And this is where we talk about flattening the curve, because if we don't do the NPIs properly, and the lockdowns and so on, we cannot flatten this curve. And there is a fixed capacity of hospital capacity, ICU capacity, the ventilator capacity, and so on, because you cannot get this even if you have money. Sometimes you cannot get them because the supplies are short. And if you don't flatten this curve, you can see that the severe cases that needs hospitalization, needs ICU and so on, will overwhelm the capacity of the hospital. So that's why we have things like MCO. That's why we have asked people to follow the new norms about social distancing and all that so that we can flatten the curve. So once this curve that from red here flatten to become blue, at least the severe cases will go below the capacity of the hospitals that we have. course, that's only one part of it. The other part is that while we are trying to flatten the curve, we also have to increase the healthcare capacity. And it's very difficult, of course, very difficult to build a hospital. Only China can do it in 10 days, and Singapore and the UK, the Nightingale hospitals and so on. For states and countries like us, it's very difficult to do. And that's why we have quarantine facilities that we use various hotels and government buildings and so on to quarantine people. So you can imagine how difficult it is. And the thing is, we all have to play our part in order to flatten this curve. I went to the Kubaharia market, for instance. People were making fun of that Sarawak now is #1, the champion, and so on, as if they are not the cause of the of being champion. We are all the cause of being champion because we are already being very lax in our compliance to the the use of non-pharmaceutical interventions. Okay, and even if we control this, if people recover, there is something now called long COVID. Long COVID is a name for a range of symptoms that can last weeks or months. Some are even up to 6 months after the COVID symptom have disappeared. And even if you have mild disease, they can also have these symptoms. So you can see that the most common one is fatigue. It feels like you have run a marathon and so on, and you're short of breath. And they show that sometimes these are accompanied by physical changes in the lungs and so on. So if you recover from COVID, it's not the end. You can end up with all these other symptoms. Okay, and so that is why it's called long COVID. This thing is going to go on. Human beings are learning a lot about it every day. And if you have done all that, how do we prevent the formation of outbreaks and epidemics? You can have a low level all the time, but sometimes when it surges, it shoots up, then that is not good for us, because the surge capacity of the hospital facilities, the clinic facilities will be overwhelmed. And we have not been as effective in 2001 compared to in 2020. The main difference is that in 2020, we had very strict MCOs. In 2021, even though it's called MCO, it's called MCO version 1, version 2, version 3. And it's as if it is not an MCO. So the difference is that in 2020, when I was analyzing the data at that time, before the MCOs, one case would have 60 contacts. After we have MCO, then the social contacts, the work contacts have decreased. Now in 2021, it is back to what it was before. And of course, I will put here that now what the staff have told me is that one case can have 50 to 100 close contacts. And these are people under investigation. These will all be quarantined. And then each of these, again, will have 50 to 100 secondary contacts. These are people under surveillance and so on. And the other thing is, we have to realize that the virus is now already present all over Sarawak. Last time it was urban in 2020. We were very worried that it will go to rural areas, and now it has happened. And this is our greatest fear. And the outbreaks and clusters occur due to super spreaders. These are individuals who can spread it to a lot of people, or it can be through a super spreader or multiplier events. For instance, weddings, birthdays, parties, all these are preventable in a way, yet people are still doing. And funerals, of course, we understand, but even for royalties like Prince Philip, you can have only 30 people attending and so on. So we read every day that the new clusters will be all related to this and also to workplace. And what happens in the workplace is that people see each other every day. They are very familiar with colleagues and so on, and they feel that they are safe in the office, and they don't use masks at workplaces. And this will lead to spread in the workplace. Okay, so all these have made our current wave, our fourth wave, very, very steep, because it's once it has reached a certain level, it's just like a fire. When it's still small, it's very easy to put out. Once it's big, it's very, very difficult to control. In a way, we have to wait for it to burn out, maybe. And you can see that Sarawak is red. Many areas are red as of 18th of April, 2 days ago, but it has not changed much. So of the many districts that we have, 18 are red, and all these are dangerous places, and so on. And you can see that we want to show what happens in Sarawak. This was the Sabah outbreak, and this happens after the election. And if you transpose this, you bring this back here, we have been trying to control the outbreak in Sarawak, but not successful. No, you can see here, if we didn't do anything here, it would have become here like this. But if you look at this and you put it here, you can see that we are here now where Sabah was here, and we are probably will be the same. We'll be shooting up here. And you can see how long it takes to bring it under control. This happens in October, and it ended up until March here and so on, and it was at the end of January before it comes down. This came down, and then probably because of Christmas, New Year, maybe it would have gone up again. So you can see that it is very dangerous time for us. And we have Ramadan, we have Hari Raya coming, we have Dawie coming. I don't know, nobody knows how far this can shoot up, because when we project it, you cannot predict where it will come. There is no plateau in sight. Okay, so which areas in Sarawak are worst affected? And if we look at the transmission rates, we have to look at something like what we call number of cases per 1,000 people, because Sarawak, different parts have different number of people. So if we use that, then we can see that the central region, Cebu, Kapit, Serike, Mukah, they are very high. Okay, and this is Sarawak as a whole, and this is the northern zone, and the Bintulu, Miri, and so on. And this is the southern zone. So things can change very fast, but you can see that if you describe this graph, you can see that all of them are shooting up. You can see that Cebu, this was the early part of the infamous outbreak that we had that scattered the virus throughout the whole of Sarawak and so on. And then the rest are also shooting up, but not as steep as this. So we are not out of the woods yet, as the expression goes. Still dangerous times for us. And you can see how many cases there are in ICU per 10,000 cases. So this is the whole of Malaysia. This is Sarawak, the number of ICU cases compared to the number of active cases, and how many percent are intubated. You can see that in Cebu, there are higher percentage of patients are intubated compared to the rest. This means that the cases there come in a severe state and so on, such that they need to be intubated. Okay, and you can see the reflection of this. A lot of the deaths in 2021, for instance, is occurring in Cebu. I think in the first 2 months of the year, we had more deaths from COVID-19 compared to the whole of 2020. Okay? So you can see that it is very difficult for us. The NPIs have not managed to, the non-pharmaceutical intervention have not managed to control the outbreak as of now. So this is where the role of vaccines will come in. Okay, and vaccines have a role in all these. They have effects to reduce the number of new cases, reduce the number of severe cases, prevent the formation of epidemics. But for this, we need a high number of people to be vaccinated. For instance, 70 to 80% of the population need to be vaccinated. And then we also know that vaccines will reduce the number of deaths and so on. So once all this happens, then our hospital beds, our ICUs, our ventilators, and so on will not be overloaded with COVID-19 patients. So again, to remind ourselves that vaccine is a new addition to this Swiss cheese kind of defense that we have. Remember that none of them is perfect, but all of them together will give us protection. Okay. So I want to show you first that the real world of COVID-19 effectiveness, and the example is from Israel, because they are the ones who have vaccinated the most of their population through their arrangement with Pfizer and so on. And you can see the United Kingdom and so on. Chile is different in the sense that they use Sinovac vaccine, and Chile is another story, but that's for another talk if you want. But we can see that the the Pfizer-BioNTech, for instance, COVID-19, the effectiveness, there are five things that you look for, what we call endpoints when we do the study. Of course, there are clinical trials. In clinical trials, we call them efficacy, vaccine efficacy, because they are under control conditions. Whereas when we actually put them in the field, they are called effectiveness. So you can see that the COVID-19 vaccine, the Pfizer in particular, after 7 days of the second dose, it has reduced the infection by 92%, symptomatic illness by 94%, hospitalization by 87%, and severe disease by 92%, and death by the end of second dose, they cannot find because there is no death, so they cannot estimate the thing. And these are based on not small numbers of patients, of patients, but it's based on 4.7 million patients, which is 53% of the Israeli population who are registered with this service provider. Okay, so this is a real population-based data. So it is effective in all these areas to reduce infection, reduce symptomatic illness once you get it, and once you get it, it reduces severe so that you don't need to be hospitalized and so on, and very effective in preventing death.
Datu, you have 9 minutes to go.
Okay, thank you. So with that as a background, we look at vaccines. We looked at the effectiveness just now. We will look now at what we call vaccine platforms, because there are many ways. These are the things that make people worried, because people are very familiar with this inactivated vaccine here. What they do is take the vaccine, heat it up, or kill it with chemicals and so on, and after that inject it into humans. Basically, that's what is done. The trick is that you have to inactivate them in a certain way. Sometimes if you kill them too much or weaken them too much, then it is not as effective as others. So these are the newer technologies, the DNA and RNA vaccine. This is used by Moderna, Pfizer, and so on. This is the Sinovac, and there are others, okay? And the thing to look at this is, of course, this is from the UK point of view, but the doses that is needed and the storage. You can see that the Pfizer and Moderna, they are stored at -70, because I'll show later, RNA is very, very unstable. If you don't keep them, even if you shake them a little bit while they're frozen, they will be fractured and so on, and not effective anymore. Okay, so that's the thing to remember. Okay, and so mRNA vaccine, the reason why this is chosen is that you can produce them very fast, whereas the traditional vaccine, you have to grow them, and then you inactivate them through various things. It takes many processes, and you have to make sure that the process is very clean. There are not active virus inside, for instance, and so on. So that's the difference, and this one can be produced faster than the traditional vaccine. And the reason why we keep the mRNA super cool is like I mentioned just now, because mRNA is very, very unstable at higher temperatures. And then if you look at the safety, people have talked about this cannot be safe because it's so fast. How did they manage to do it so fast? They must have taken shortcuts. You know, the traditional vaccine will take 15 years or longer to develop, whereas this one took 1.5 years. But the reason is because they compress many parts of the clinical trial. They will do like phase 1, 2, stroke, 2, 3, stroke. They carry them together. It's not that when you finish one, then you do 2. This one they continue doing. And then the other thing is last time they produce large scale production in the factory only when all these are finished. So now the companies take a gamble and produce it here even before they have finished the phase 3, and they will submit it for regulatory authority and so on. And like the mRNA one is not completely new, because people have been working on the technology for the past 20 years. So all this you need to understand. There was no shortcut inside, but it's the way that the trials were conducted that managed these things to be the overall process to be shortened. And the other thing that it took a long time was, it took a short time, was that the US government had this Operation Warp Speed, and they injected many billion dollars of money so that the companies did not wait for investment from people in order to start start work on this vaccine. And people were also saying, how can this vaccine be safe? It is safe. Why do they ask? Why are they saying that they are not responsible for vaccine side effects? So this is a long story going back to the 1970s when vaccine producers refused to produce vaccine because just one adverse side effect, people will sue them for the millions. And so the government say, okay, we will take over assume the responsibility for vaccine adverse effects. You produce the vaccines, and that's why they have all the mechanisms of FDA approval and so on. So it's not because this vaccine is not safe. That's why the vaccine companies don't want to assume responsibility for it. So it's a long story. But people use this as an excuse to say that it must be because it is unsafe that they don't want to do this. And at the WHO, they follow all these things, the pre-emergency, the submission of the things, and a lot of things were done on a rolling basis. They need not wait for the first stage to finish before they submitted for the other phase and so on. And these are the documents that the companies have to produce in order to get the vaccine for emergency use with the WHO. Similar things are done by the European Medicine Authority, the FDA, and also our own National Pharmaceutical Regulatory Authority in Malaysia and so on. So as of yesterday, more than 200 million people in the world have been fully vaccinated. And this is a good thing. This is to show that at least 200 million people are happy to be vaccinated, okay? And the efficacy, then when we look about, so one is safety, the other one is how efficacious it is. And the WHO have put that the threshold must be more than 50%. And you can see that the Sinovac, for instance, is just above 50%, but you can see the confidence interval is from 30% to just over 60%, and the other vaccines are all here. So when we look at vaccines, we look at safety. That's the first one. And that's where phase 1, phase 2 trials are being done. And phase 3 trials are looking at efficacy, okay? And of course, now is because of variants. This is not because of vaccines that it comes. The virus mutate all the time, especially with mRNA viruses. And these are the various variants that they are. And some of them are able to be more infectious. Some of them are able to evade the antibody in the body and so on. So the ones that you may have heard of is the UK variant, the South African variant, and also the Brazil variant. Okay, and some of the efficacies of the current vaccines against this variant, for instance, the UK one, they have the same efficacy. The ones that is of concern is the South African variant. And it is because of this that you hear news and things that you may need to have a booster dose in order to fight against the variant and so on. And especially in the case of Pfizer, because they use and the mRNA version of the vaccines, they can choose which part of the virus to put in that particular module of the virus, just like a flu vaccine. That's why for flu vaccine, you have to have a vaccine every year because of this. It's very similar. Okay, adverse reactions, I would just like to say that they are minor, they are major ones. I'm going to just look at the deaths, anaphylaxis, and blood clots because these are the current ones. Death is already past, people don't talk about it anymore. But the thing to remember is that these adverse events are able to be detected. Actually, it's like a needle in a haystack, but they are able to be detected because the system that is set up to monitor all these adverse events are very, very sensitive. It detects things in the millions, maybe 1 in a million, 10 in a million, okay? And usually the adverse reactions are can be due to two things. The first one is the vaccine payload. This is the part of the virus that is entered in the body. The other one, it can be because of the vaccine transporter that is used. For instance, for the Pfizer vaccine, it may be because of what is called the PEG, the thing that is used to envelope the virus component. Okay, so the minor adverse events, I'm not going to talk about it because they are very minor. Injection sites, generalized symptoms like flu illness and so on. And we have been giving so many of these in Malaysia and in Sarawak as well. And they tend to resolve within just a day or two. And they are more frequent in younger adults, maybe because their immune system is stronger than in older people. Would like to deal a little bit longer with the major adverse events because these are the things that people are very worried about. You read about deaths in Norway and so on among the elderly, and it's found out that they were mainly in people over 75 and with severe underlying health conditions and so on. And just remember that as a baseline, an estimated 45 people die in nursing homes or similar institutions every day in Norway because they are an aging country, and they have a low threshold for reporting adverse vaccine reactions, and there is no connection. Now people don't talk about this anymore because it's true that connection is not there. The other thing that we were worried about when the first Pfizer vaccine was first rolled out was about the anaphylaxis. This is where you have a severe reaction to the vaccine, mainly due to the envelope of the vaccine that is used to coat the RNA of the virus, and it is very severe in the sense that you will not be able to breathe because you have swelling in your neck and so on. But this can be resolved by giving the adrenaline and so on, and these are present. That's why when we vaccinate people, it has to be done in a center, and there are emergency trays that are there, and they can be reversed. So you can see that the deaths due to COVID itself, at this time when it was done in January, 346,000 deaths in the US already, and it's 1 in 1,000 death due to COVID. Whereas even for penicillin, you can have a similar reaction, and you can have 500 to 1,000 deaths cases per year. This is in the US context. And the vaccine is here more than with penicillin, but the number of deaths is very little because you can be treated straight away. And if you have an X-ray contrast, in some of the X-rays, they give you an IV contrast, it will cause you even more anaphylaxis reaction compared to from the COVID-19 vaccine. And now the concern now is about blood clots. And the European Medicine Authority finds possible link to very rare cases of unusual blood clots with low blood platelet levels. And one of the studies that was done in the US looking at this, they look at, you see, 500,000 records for COVID-19 diagnosis, influenza, and 500,000 of those who have received the mRNA vaccine, and then they compare the incidence of this cerebral venous thrombosis in these patients. And what they found is that if you have COVID, your chance of getting this central venous thrombosis is almost 40 per million. But this was not reported before because it was considered as one of the effects of COVID. But then because, as I mentioned just now, once you give the vaccine, people are looking at all the possible side effects. And lo and behold, you find that there are 4 in a million for the Pfizer vaccine. For influenza, you don't have. If you have influenza compared to COVID-19, you don't have the central venous thrombosis. But this is the Oxford AstraZeneca, which is the one where it was first found out. It's 5. So it's very similar to the Pfizer one, And this one is in the brain. This one is in the portal vein. The problem with this is that you see the anaphylaxis just now will happen within 15 minutes of giving the injection. This one can happen even a few days later and so on. And once you get it, the chance of dying from it is 20% per year and so on. That's why people are worried. But if you look at the context of it, it's very much less than what you get from COVID-19 itself. So everything is about risk and benefits and weighing those risks and benefits. So the vaccine uptake is next because in order to be able to control the outbreak, the vaccine must go into a person's arm. And that's why a vaccine, the original slogan in the US was vaccine in the fridge is no use. Vaccine in the arm is the one that you're looking at, you're looking for. And they did a study in the world, 66% are vaccine supporter, some are hesitant, they wait and see. 12%. There are those who are obligated. They will take it only if it's needed for travel, for entering university, for school, and so on. And the others are skeptical. They won't get the COVID-19 vaccine. And out of these, 1.4% are the anti-vaxxers. They will never get any vaccine at all. It's not just COVID-19 vaccine. So we will know where we are ourselves with where these things are concerned. Okay. The next one is vaccine supply. The problem is not that we cannot give the vaccine, deliver it. The system is there for us. Dr. Radziah will talk about this later on. It's the supply. The global supply is very short. And you can see this is the global population here, almost 8 million. And this is the maximum capacity, manufacturing capacity of all the vaccine manufacturers together. We can never cover everybody. Okay? And on top of that, the rich countries have booked so much of the vaccine that they have very little left for the rest of the world. So it's very difficult to get. And there are many other theories about the vaccine. People are saying, why do we need a vaccine when this is mRNA is not even a vaccine at all as defined by FDA. A vaccine is you take the virus and you weaken it or kill it and so on. That is a vaccine. mRNA is not a vaccine. And the other one will say that mRNA vaccine will modify your genes. This is not true because after 72 hours of it entering your body, the mRNA will be destroyed by the body. Okay? But meanwhile, the body will recognize it already. And then the latest thing is that they said vaccines will suppress your natural immune system and so on. And this is again not true. The thing about all this is that these people who mention all this all have qualifications. They will say, I'm this doctor, I'm that doctor, I'm a vaccinologist, I am immunologist, and so on. But I think the best person, this is called the grandfather of vaccinology. He developed the rubella vaccine, Stanley Plotkin. And of course, the people will, because he's so famous, many of the vaccine companies are asking him for advice. So he is an advisory member of many of the vaccine manufacturers. And these people are saying, look at him. You don't listen to what he says because he is very biased. He is advisor to all these vaccine manufacturers and so on. So I leave it to you to do your own judgment on that. But on the other hand, people are saying that there are alternative treatments, orphan treatment, they call them, colchicine, which is used to treat gout, ivermectin for treating worms in animals, vitamin D, and so on. And studies are being done on some of these. Some have been disproved to have no effect after you do a case control study. And the latest one they published is the antiviral molnupiravir. We hope that they are doing now a study. They have removed the study from the hospital patients because they said it does not contribute to any effect. They're looking whether this has any use in outpatients and so on. So we will look at this and see how it develops. And it won't be ready within this year. So we have to have this vaccine. Okay. And so the last one is people are saying, why should I get the vaccine? Because even if I get the vaccine, I will still get infection. And this has happened reported in Malaysia and so on. So this is related to two things. One of them is the efficacy of the vaccine, because just imagine in layman's term, it's very easy, 95% efficacious. That means if we give it to 100, maybe 5 of them will not be protected and so on, insufficient antibodies. The other one is if you develop antibodies, how long will it last? The longest trial, the longest duration now people found is 6 months. So we have to wait and see how long the level antibody will last. And of course, the other one is the variants. So even though this has happened, this is not unexpected, as the medical people would like to say. And this should not be a reason to say that I will not take the vaccine because it is useless. Even if I can get vaccinated, because it prevents you from getting severe disease as well. Okay. But that's also the reason why we say that even if you take the vaccine, you still have to follow the 3 C's: use masks, avoid close contact, and wash your hands, and all those things. So I have, what I've done here is to share with you the control of how are we going to end this COVID-19 pandemic, the difficulties involved, and where the non-pharmaceutical interventions come in, and where the vaccines come into play, and so on. So with that, I thank you very much, and I thank SDI for giving me this opportunity to share this with you. Thank you.
Thank you, Prof. Thank you.
Yeah.
Thank you for that. Thank you for the presentations. We do have a few questions already in the chat box, but then we will address them all together during the Q&A sessions later on. So we will proceed to the next speaker. But then before that, let us conduct the second part of the poll. So can we have the second the question? Okay, the question is: Have you registered to be vaccinated? Okay, majority have registered. We do have a few not registered yet. Okay, so I think we have majority already vaccinated, already registered to be vaccinated, which is 96%. Good. So the next questions. Which platform? Which platform did you use to register? So here we have the online systems. Online systems here we have three, which is MySejahtera apps, registrations via the JKJAV website and their hotlines, or the manual registrations via residence office, community leaders, OYBs, or at the government clinic. This is actually manual as well. Okay, so majority is using the online system, which is the MySejahtera apps. We do have a few via the website, and then quite 10% manual registrations via residence office and the government health clinic. Thank you. So the next one. Next question is about how many platforms do you use to register? This is quite related to the earlier questions, is that whether you are only using the MySejahtera, or you also use MySejahtera apps, or you also register via your KRT, YB, community leaders. How many have double registered or triple registered? So, or only use online system only. Okay, so we do have 31% combining using double online system plus manual registrations, but majority are using online systems, only 65%. And then we have 4% which is using manual only. Okay, last questions for these sections is on why those who have not registered. If you have not registered, why? This is for those who answered just now, why they didn't have yet to register. So it's a fear of the side effects, do not know how to register, not confidence, wait and see. This one you can choose more than one reason. Okay, the result is most 45% not confident with on the efficacy of the vaccine, and wait and see the result on the phase 1 and phase 2, and also the fear of side effects. So these are the top 3 reasons. All right. Thank you so much for your participations. Now, without further ado, I would like to hand over the sessions to Dr. Radziah. Dr. Radziah, over to you. You have about 15 minutes or 20 minutes for your presentation. Thank you.
Thank you. Okay, I share my slides. First of all, I would like to thank you to SDI for inviting me, and to all of you who are still, joining us here. Let me briefly talk about our immunization program, right? So by now, I think everybody know that our immunization program is actually the objective is to protect our frontline personnel from COVID-19 infection. We want to minimize morbidity and mortality among high-risk group, and we do want to create our herd immunity for economic recovery, because we know this is very bad moment. And then at the same time, we are going to control our outbreak by using these methods. Okay, so for COVID-19 vaccination policy, at the moment, only people aged 18 years and above are eligible for vaccination. And this is based on the vaccine trials for each of the vaccine that are in the market now. We are targeting about 70% population of Malaysia, including those non-Malaysian residing in Malaysia. So it's about 23.6 million. And even though we said they are the eligible population, this vaccine also is only will be given to those who are consented. Yeah, that's why we will take your consent first before we give the vaccination. And implementation of this vaccination COVID-19 vaccination program is actually in 3 phases, beginning end of February 2021, and it was planned for 12 months duration. And I would like to stress again, policy also stated that we can't choose our type of vaccine that we prefer. It is based on the offer that made by the government at the time. Okay, so looking at these target groups for the 3 phases of vaccination and the estimated number of individuals to be vaccinated in Malaysia. For phase 1, we are actually looking into and giving to the frontliners, and frontliners, they are further divided into priority group 1 and priority group 2. The priority group 1 includes those who are in healthcare line, and it includes both public and private personnel. And for priority group 2, it consists of those in essential services and defense, also the security personnel. So for this phase 1, the 500,000 people were aimed to be given the vaccine. Yeah. And in phase 2, actually it's kind of overlap. It started in April till August 2021, and we do have the priority group still exists, whereby we are going to give to the remainder of healthcare workers and also those in essential services and defense and security who we can't cover with in phase 1. And on top of that, we are going to give to our senior citizens, those aged 60 and above, and also people with high risk group with chronic diseases, and also people with disability. And in this phase 2, we are hoping to cover about 9.4 million population. And in phase 3, beginning of May 2021 until February 2022, this is the national one. Okay, and the priority group will be to adult population age 18 years and above, and these are also going to be given to those in the red zone, followed by those in the yellow zone, and finally those in the green zone. That's how we are going to prioritize our group 3 later, and this will include about 13.7 million people. And also at the same time, we are going to use it for pandemic control measures. So as for Sarawak, what we are going to do is actually looking at this. Sarawak has got 2.9 million population, and out of that, about 2.8 million the person that we want to give vaccination, and it is about 71.7% of Sarawak total population. That equals to about 100% of population more than 18 years old. This is very critical. That's why those who are eligible, we really want you to come forward for vaccination for us to get the herd immunity. Okay. So as for Sarawak, we are not going, to extend it until next year. We are trying to get our activity completed till August 2021. And all this planning is actually depend mostly by supply of vaccine, okay, to Sarawak. So if you looking at the COVID-19 progress for Sarawak, we actually did our preparation early as last year, actually in December. And then at the time we identify our PPV, PSV. PPV is Pusat Pemberian Vaksin, Pusat Simpanan Vaksin. We train our personnel and also preparing for the logistic preparation for some vaccine that we know really need temperature maintenance. The maintenance of cold chain is very, very important in ensure our success of vaccination program. So the commencement of the program actually was done on the 26th February 2021, when we actually gave to YAB CM of Sarawak. And then at the same time, we initiate giving to the frontliners, and this phase actually happened between 26 February to 3rd of April. And in phase 2, which actually in Cebu, we already started it yesterday, and it will end till May end. All this, planning really based on the vaccine supply. So we are hoping that by 31st August 2021, we can complete giving about 71.7% of our eligible population. So as of 17 April 2021, if you're looking into this chart, to this graph, we already gave about 155.3% more than what we expected, given our frontliners listed was about 43,875. Then we already gave for those one about 68,000. And those two, up to yesterday, we already administered about 32,655, and we are hoping that before April end, we can finish the frontliners second dose. And coming to phase 2 and phase 3, we are now with CITF. CITF is COVID-19 Immunization Task Force, which is responsible to ensure this program success. Okay, we are preparing our KKM KKM facilities and also non-KKM facilities for us to deliver the vaccine to the community. So about 125 hospital and clinic, this is government clinic that we are already recognized to be our location for vaccination. And also there are non-KKM facilities, about 154 which include Day 1 and also Stadium. Yeah. And we will also visit and do our outreach mobile vaccination to the elderly care centers. And apart from, as I mentioned just now, apart from hall, we are also doing it in our MOH facility. And but I think tomorrow there will be a briefing of how to include private clinic into our program. So in phase 2, the vaccination not only it's going to be done by our government facilities, but it will be also offered in private clinic. This is mainly for those people, the high risk patient who we know some of them, they never visit our public health clinic, but they always they are the client of the private clinic. So we also want to include them in to smoothen the process. The same thing like phase 3. Phase 3, since this is the the target group is actually going for those who are healthier. So we are aiming to go to universities, the students in a institution, and the program that we offered in the non-KKM facilities also will be diperbanyakkan in all these areas to cover every sectors in that we recognize. So coming to the COVID-19 immunization program registration, just now when I see the vote, I'm very happy to see actually the online registration is above 50%, right? It's 65%. And the one that worried me when I look at it is actually about 31% did double registration just now. So anyhow, we actually promoting everybody to register and register through the system, so it can capture how much vaccine that Sarawak needs, because it is very, very important for us to register in the system to make sure that the government knows that how many population in Sarawak who are willing to be vaccinated. So your registration and your contribution for this activation of My Sejahtera is very, very crucial to ensure that we get the amount of vaccine that we need. Okay. So as for 18 April, the total registration for the whole Malaysia was about 8 million, and it's actually 37.1% of our total population. And for Sarawak, we are at 39.6%. It gives us about 820,000 population who are already in the system. Okay, and just want to highlight again that the registration of COVID-19 vaccination is not only through My Sejahtera. It can be through the website, JKJAV website, which is stated here, www.vaccinecovid.gov.my. You just click here, and then they will offer you a registration. Either you want to print out, or you can actually register online. And if you do not have the access, you can actually call the hotline 1-800-888-828. And if you cannot have this, okay, then you can register manually by visiting the nearest government health clinic and also district office. Okay, they can also help you to register for this program. Okay, and also for Sarawak, we do have this online hotline for you to call if you have any problem, anything that you want to ask about this registration. Okay, some people were asking why did I not getting my my appointment when I already register with the My Sejahtera. For your information, the appointment will be set up in phase 2 and phase 3. The appointment for immunization is actually set up by the system. So how the system knows and weightage your prioritize you as a recipient, they will see these 4 domains, which is your age, your either you are OKU or do you have any comorbids. Okay, and if you are in the outbreak areas, so if these are the way they weightage you, and if you are age less than 40, the computation is by computation, and actually the weightage goes to 33% of each of these parameters. Okay, and some may we have a lot of questions that ask us why we are in the same house, but we get different dates. Why my mother and my father, they are in the same phone, but they cannot get the same date. So having that much of questions, yesterday our YB KJ okay already announced that this married couple may call the vaccine registration hotline to get the same appointment slot if they happen to register separately or given the appointments separately. And also for those who are it actually applies to spouses and also individuals and their dependents. Some may ask if my father is going with somebody that when I cannot accompany, can we bring one carer to the vaccination center? Actually, it is very welcome. We will allow one assistant or one company to accompany these dependent. Okay, and I think for the immunization program campaign, we have done it so far. There are a lot of things that UCAS and also Encik Aziman are doing at the moment. Yeah, we have a radio talk to put information to all these Sarawakian, and we have vaccination talk by pharmacists on TV. We have vaccination by our own deputy chief ministers, and we also do have our YAB CM to launch the program. So I think the engagement with multiple agencies at different division actually been done to ensure that our population get the information and register, and soon we can vaccinate them when the times comes. So I also would like to emphasize here that it is not only medical personnel that are going to handle the vaccination centers. It will also the Jabatan Belia also are responsible to recruit volunteers to help us in the COVID-19 immunization program at our PPV. So whoever who wants to volunteer in this program may still do so by visiting this volunteer now at my VAC. Okay, I think that's all from me. I think thank you very much.
Thank you, Dr. Radziah. Thank you very much for the presentations. We have quite a lot of questions, but then we will again address it later on. So we will now proceed to the next poll, the final poll before we invite Hadi Aziman to present. So the next poll will be more on the vaccination. So what is your first source of information regarding the vaccine? Where did you get your information? On the vaccine, this one is regarding the vaccine first. Give me a few more seconds to read regarding the vaccine, where you get the information from. From radio. Radio can be under the local media outlets, newspaper, TV, radio. Okay, I think majority are getting it from the Ministry of Health Malaysia, FB. Okay, the next one is the first source of information regarding the vaccinations. The first question, the other question just now is regarding the vaccine. Ini adalah proses vaksinasi. So this is on vaccinations. It's a different questions. All right, I think majority again is getting it from the Ministry of Health Malaysia, Facebook or website. All right, so we'll proceed with the last questions of our poll today. This is regarding your satisfactions with the communications on COVID-19 vaccination program so far.
Is it on already?
No.
Check.
Yeah, I think it's
Is it?
not yet. Okay, I think majority said it's quite close. 51% said can be improved further. 42 said satisfied, and 6% said not satisfied. All right, thank you so much for participating. Now I would like to pass the time over to Haji Aziman. Haji Aziman, over to you.
Yes. Thank you very much. Thank you very much. Can you hear my voice?
Can.
Okay, thank you. Yes, okay, to ask another question about what do you prefer, which platform you want to hear to get information regarding COVID-19 vaccination. I think that's the most important, one of the important thing to ask, right? Maybe can add next time. Okay, salam sejahtera to all and Ramadan Kareem to all who are fasting today. I'm grateful to the organizer, the Sarawak Development Institute, SDI, for inviting us to the talk. So I'm Aziman Ahli from Health Promotion Sarawak State Health Department. We're glad to share my part of the strategic communication plan for the COVID-19 vaccine. I might say that this plan is in line with what is said by our ministry, but with a few additions for Sarawak and modification in terms of some needs for the Sarawak itself. And if at the national level, earlier, before the establishment of the COVID-19 Vaccine Supply Access Guarantee Special Committee, the JAV, spelling it right, promotional activities were led by MOSTI, the Ministry of Science, Technology and Innovation, and our MOH through Bahagian Pendidikan Kesihatan, and actually is one of the communities together with CDC from MOH itself. For Sarawak, we have also established the Publicity and Promotion Subcommittee of the COVID-19 Sarawak Vaccination Action Plan, led by the UKAS, Unit Komunikasi Awam Sarawak. Those organizations that are involved mostly from the media, from the government, the private, including Jabatan Agama Islam and UNIFOR from other regions. And the next slide, wait. It doesn't move. Wait, it doesn't move. It doesn't move. Okay. With the kick of the national immunization program at the national level by the young Mohamad PM on the 24th of February, this year, our team is ready for the same implementation, with the main objective is to get safe and effective vaccines for the whole Sarawak population. The point is, with the availability of a vaccine, especially to the supply to Sarawak, we expect to control the spread of the epidemic. And we're aiming the priority group, which is the frontliners and those who are high-risk groups, to get the vaccine. Like the ministry, through the SDMC, Sarawak Disaster Management Committee, we also conducted a brief vaccine acceptance online survey. I just carried out around from 11 to 25th of February 2021 among the people of Sarawak, actually the resident of Sarawak, to get some brief data before the start of the implementation of vaccination for Sarawak program on 26th February. And it showed that from just getting around 4,000 over respondents, we managed to get 74% who were ready to receive the vaccination for COVID-19 vaccine. 20% were not sure whether or not to receive the vaccine, while the other 6% did not agree. I want to move the slide to the next slide. Slide is not moving. So based on this scenario, the strategy for media and communication plan is to give as much effort to explain and publicize the importance of vaccines plus the government efforts to control the pandemic. So next slide. Okay. So as you can see, this is a slide which shows the vaccine acceptance online survey carried by us with the SDMC. From 11 to 25th of February 2021. But just to compare with the national level, next. Okay, just to compare with the national level, just this morning survey on the second version, ours is not so different, which is 10% to 20%. This means ours is 20% earlier for the first version, but lately, just this morning, we have the data from the ministry. They are getting 10% for those who are unsure. So we hope that we can do another 2.0 surveys, second version survey, as soon as possible to get data that we can compare. So okay. However, we also have a look at some limitation for Sarawak that need to be taken into account for the plan. Namely, at first, firstly, problem of the coverage to the whole Sarawak plan, especially to reach those at the remote area, especially Rumah Panjang and some of the area like Seoul, Kapit, and that's like Baklala, whatever. As well, secondly, problem that of multi-languages, dialects, giving the best possible understanding of the information given. Thirdly, as to also take into account the level of the health literacy itself among targeted group. For Sarawak, it is diversity so much, and some other issues as well. So, as a general objective for this plan, for this strategic plan, for the general one is first is to maintain the exception of the COVID-19 vaccine among the asset group. So for the survey, those who are ready to receive by category is public itself is 73.4%, and the elderly is 79.5%, and comorbid is 75.4%. This is to maintain those target group. And for second objective, under the general objective itself is to increase those who are already those among the group of unsure or not sure. Those are at public side of 21.1%, elderly is 17.2%, and comorbid around 16 to 7%. As the target for Sarawak 18 years and above, which is around 2 million over, our plan is to execute according to the phases 1, 2, and 3 as mentioned at the side. We have also used the marketing mix strategy as much as possible. This is 4 P's: is promotion, product, place, and pricing. For the cost is already incurred inside the things. So, as example, we are using one of the figure, like let's say, like we're using the concept, 4 P's concept. It is like having the sandwich man. It is like having this VIP person or special figure to endorse our vaccine by getting themselves first and to persuade others about the safety of the vaccine. I will show the pictures later. So for the time frame, we started earlier, weeks before the launching by CM, our Chief Minister, on the 27th. He himself getting the jab on the 26th. But like as well, the national level, we done it earlier previously, and we will be ongoing until the vaccination program end by August as planned, as well as we can. So we have 4 specific objectives, as mentioned. So the first one is to increase the awareness and knowledge about the needs to download and active MySejahtera apps among the target groups. This is the most important things, but since Sarawak need to add modes for registration, especially for those in the remote area, so we are to include others alternative for those, especially who do not have a MySejahtera account. So in order to raise the awareness of the need to download and activate MySejahtera account for COVID-19 vaccination among target groups, we're still using the voluntary of communication, which is to cover as many as we can by using all the conventional and social media channel that we have. Here we enhancing the cooperation among our teams plus other agencies as well, like the Jabatan Perangan, the UNIMAS, the RTM, TV Sarawak, Bernama, KES, and other media as well. Next, the second objective is to maintain the percentage of the acceptance. This is 74%, the target. So to compare to other surveys now, we found out that 62% of respondents were ready to receive on the recommendation of the government. So this is our opportunity to do a campaign by using government channels as many as we can. So third objective is to reduce the percentage of unsure at around 20%. In short, is to change their stance from unsure to accepting the vaccination first. For this second and third objective, accurate information is very important, and can it sustain or change the perception of the targeted group. we understand we are competing with viral issues, negative perception, anti-vaccine group, and other areas as well. That's why other than optimizing conventional media, we're expanding delivery of accurate social media channels. Mostly the convincing messages through new media, such as using the various channels. The help comes from most of our committee members, this mentioned just now, plus the media. So thanks again for the cooperation given this NSC. It is still going actually. So our strategy is shown in the focus there. The column is by to show through outdoor activities. This one should be okay. To improve positive perception on COVID-19 vaccine through related knowledge and awareness for the side effect, for safety, effectiveness of the content used, and other question appear most anticipated by the publics. So to optimize conventional media channels for disseminating information plus expanding delivery of information through new media as well. Then other strategy is to show some outdoor activities by using such tangible product or tangible materials such as billboards, forum, town hall, khutbah, sermon, and others related. Maybe some is not suitable during the MCO or PKPD. Despite that, the peer group strategy is influencing is the most best way to achieve the objective. By means still complying with the SOP, this can be done as what Health Minister launched last year, 2020, by the CAPP, Prevent and Educate, Practice, Comply and Monitor. And then for the RPP, for COVID-19 Risk Reduction Program. So, so the most important thing is the cooperation among the public itself. That is to get the community empowerment to disseminate information as the peer group. So the final objective is to manage and further make issues among the target group, which is to correct the fake news in the environment related to COVID-19. Yes, the work is to counter against viral fake information. So for the State Health Department itself, the point is to answer any issue that triggers the community. So even our department has organized the hotline ops room, as mentioned by Dr. Radziah just now, the hotline ops room for vaccine and vaccination that we cater for the whole Sarawak. This agency are also helping in their own way as well. So the strategy is to disseminate through conventional and social media platforms. So what they've done and ongoing is short in the slide is a short picture of this. Okay, this is the messages we've done and still ongoing. Like the download for Activate Your Sejahtera as shown by helping both together at the national and Sarawak level. Radio, for TV, and infographic video, plus the crawler inside, and even for the info wheel team by the Japan and some of the frequently asked questions. So we including the side effects, safety, effectiveness, content of veteran use, even the vaccination information plan, the date, the phase, and some of the very taken care for such as the infodemic issues management. So here are some pictures on activities done previously for the media plan throughout Sarawak. So this is a meeting induction through Zoom and a session with the committee itself. This one is some of the campaigning for the Sejahtera registration and vaccination using infographic videos. Okay, this one is campaigning through social media channels. Actually, others like Japan, UCAS, and even RTM and US, they done it themselves. This is by our own Sarawak State Health Department. So this one is campaigning through social media channel as well. So this one is campaigning for disaster minimization and vaccination by website. So this is campaigning through TV. So when you see Dr. Radziah there with our director, Dr. Chin, having the Kopa Kopi section. And then from Jakim, they have at the national level, but also cater for Sarawak channel is for vaksin cegah sebelum parah, sebelum this one campaigning by radio channels with multiple languages. So we can we get the help from not only from Kuching, also the other 5 division as well. This is like Miri Bintulu, Sriaman, Sibu, and also campaigning through multiple languages that we can produce for our tangible and intangible messages such as infographic or posters or leaflets. So campaigning the vaccination to the community leaders and public, especially at the longhouses residents. So promoting endorsement from the special figures like our own CM, our own VIP, and our own minister, and then some of the our legend Wasen Yambek, and then our Ngesai. And the left side is our YBMK2 Orang Agodagang. And then launching event by the our CM, and then supporting visiting by our Yang Amat Berhormat Perdana Menteri and our YBMK, our health minister as well. And then just reporting for the delivery of our vaccine at the first site, first receiving at the airport. So this might trigger our knowledge or our acceptance of the vaccine as well. And then our special martial training program that was implemented by our minister and still ongoing until August to the all parliamentary area catered by each minister. And then this is our own hotline program immunization ops room. This is mainly for our State Department hotline to answer any question and answer regarding the vaccination, either in infographic or in others social platforms. And then this is a staff working in the site, cater for Monday to Wednesday, Monday to weekend, Saturday, Sunday, even in during public holidays, 8 to 5. And this is this sharing is some from the UCAS material that was producing in various languages. So our evaluation of planning for this activity, normally we try to include some of the normal evaluations such as how many targets group have registered and activate MySejahtera. So this is going to be our impact evaluation. The number of number of other events being done, number of complete doses of the vaccine. This can be referring to our winning strategy or not. And then number of line calls, answered, and issues being taken into account, and others as well. To conclude, we understand that even though we've done so much and still ongoing, yet if the targeted groups who perceive the susceptibility, severity of the COVID-19 pandemics and perceive the positive benefit of getting vaccinated, plus to try overcome the barriers in getting it, I think that we'll be able to ensure the success of this program. With that, I thank everyone for the opportunity to represent and all my publicity and promotion subcommittee and of the COVID-19 Sarawak team members. Thank you very much.
Thank you, Haji Aziman. Thank you very much for the presentations. Okay, with that, we conclude our presentations by all the speakers. So we now proceed to the Q&A sessions. So I will go to the chat functions. We do have a few questions, but I believe some of the questions are more or less covered during the presentations, but I just want to seek clarifications. Maybe Professor Dato would like to also address some of the topics again. Like the first question is by, hold on, yeah. It's all regarding the variants just now, with the new variants of SARS-CoV-2 virus, how effective the vaccine will be. From Chung Wei. Dato, your microphone, please.
Okay, regarding how effective the vaccines will be against the variants, I think studies are ongoing. We know that in Africa, when they did some of the vaccines, they found that it was not as effective as against the original viruses. So things are being studied. So I think we don't know the answer as of now. The answers are coming in, and as studies are going on. So, but there is a chance that we may need to have booster doses. I think that's the general thinking at the moment. You have to cater for the variants, and that's why it is important for vaccines to be highly efficacious in the first place, the vaccines that we use, so that this will prevent the emergence of the variants. Okay, that's my comment at this point in time.
Dr. Radziah, you have anything to add to that? No. All right. I think the second questions, more or less answered by Dato as well. This is regarding that, do we need to take the shot now? It will last. Whether you did a booster, you need to. It's like flu shots, is it? Like you need to take it every
probably.
year.
That's the thinking. Yeah.
Yeah. So I think they answered that questions already. So next is, I think it's about the allergies. Like a few. Like Josephine from the OA said that she's very allergic to penicillin. So is the vaccine safe? So same thing with those who have got asthma, high blood pressures, etc. So is it safe for
Radziah
them
can
to
give
take?
the official guideline for that.
For those who are having allergies or any comorbids that they that listed, actually when they are in the pusat pemberian vaksin, there will be assessment before giving. Okay, so all these people, doctor will see these people first if they are fit to be given at that time, or if they are not fit, they may defer, and they may advise the person to go to the hospital to take it at the a better place for a preparation if anything untoward happen. Okay. The other thing that when a person that having diabetes, asthma, hypertension, these are the people who, if they get the COVID-19 infection, they are going to be worse in complication and all those. So these are the people that we want to vaccine more than others. So they do not have to worry about that. Just make sure that they are at the optimum level of the treatment. So the vaccine is very advisable for them to take.
Okay, thank you.
I think the general advice for allergies is that minor allergies like asthma and so on is not an absolute contraindication unless you have been admitted or severe allergy. For instance, there is a severe allergy called, for instance, something called Steven Johnson syndrome and so on and things like that. Those are the ones that will need to be very, very carefully monitored. The other thing is if you have a history of allergy, then the staff at the vaccination center will observe you maybe for longer. The usual time is 15 minutes because, like I mentioned earlier, most of the reactions, if anything, will occur within the first 15 minutes. So if you have a history of allergy, you can request to be observed for half an hour, for instance. Yeah, isn't it, Radziah?
Yeah.
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 Okay, then I think next one was like, just now I missed this one. Is there any result? I think we basically quite know this, like there was questions about why only 18 and above is to
Oh yeah, I saw that one because
Select.
what the thing is, the vaccine is based on research. It's based on clinical trials, the results of clinical trials, and it so happens that the subjects that were given the vaccine to during the clinical trials are people above 18. And except for Pfizer, I think in some of their studies, they were giving it to 16 and above. But most of the others is from 18 because those are considered consent age and will be easier to get, and children are considered vulnerable. So that's the reason that it's not given to children. But in Israel, they're giving it to 16, 18 years old because the Pfizer vaccine actually, like I mentioned, started from 16, but in Malaysia, we're giving it from 18 and above like the rest of the world. But there are studies being done by other vaccines. For instance, the CanSino, they are currently doing studies in children. So those are the reasons, because it is all based on science and the results of clinical trials. So if the age group is not included in that, then they will not be given to those age groups. For instance, some of the vaccines, there were very few people who are above 60 in the clinical trial. They were there, but happened to be maybe just a few thousand. So that is not enough to give confidence in the result. So that's why some of them, they don't say that we don't give the vaccine to people above 60. So those are the reasons for the various age groups. Yeah.
Thank you, Datu. I think the next question is the Sarawak target. I believe this was already covered by Dr. Radziah just now in the presentations. The target before August 2021. This is for the number of vaccinations. So next one is about people with disability, or OKU. So please clarify what would be the issues when they are brought for vaccinations, because people with autism, Down syndromes. So is there any like special arrangements for these kind of people when they go for vaccinations due to the special needs that they have,
Okay, for as what I mentioned just now, OKU, these are the people that included. One of the criteria, the weightage is actually the OKU. So mental disabilities, autism, Down syndrome is actually under OKU list. They are the people that we are going to give in phase 2. And in all PPV, for those who really needs, we have a line special for this OKU. So all the PPV are taking this initiative to make sure that OKU is getting their own line to make sure that they are prioritized and helped while being given the vaccination.
Okay, thank you. The next one is from To Chi Leong about kenapa bekas mangsa COVID-19 hanya layak ambil vaksin 6 bulan daripada tarikh kena COVID-19.
Datuk, do you want to answer that or you want me to answer?
You answer.
That is the gist of the gist of the question is why they are only eligible for vaccine 6 months after the last infection date.
Okay, going to first principles. When you develop, especially like a viral illness, you'll develop antibody. And if you have antibody, and then we give you a vaccine, the antibody may fight the vaccine, and it may have less effect. So I think studies have shown that the antibody starts to go down after 6 months, and I think that's the reason that it's recommended after 6 months. So yeah, correct, no?
Actually, for our guideline at the moment was saying that for those who are, who are already infected, positive COVID, now the guideline said that we can defer 3 to 6 months of being positive. Okay, so we when they are, when we have a lot of limited supply of vaccine, okay, for those who are already positive, as what Dr. Datu Andrew mentioned just now, they already have their protection, so we can defer them, but we will give them the vaccination after 3 to 6 months.
All right, thank you. So I think red zone being targeted first for vaccine distributions, I think this already covered just now. Sarawak is going to target red zone being for vaccine distributions, right? This one already covered just now. All right, so from Salhazrin, what is the most reported AEFI, the adverse effects following immunizations in Sarawak so far?
So far is a minor side effect like local injection pain, you see, and fever, which subsided after 2-3 days. But I have been monitoring these AEFI reports, and for the past 2 days, we haven't have any reported side effect. We actually would like everybody to report any side effect that they experience, even though it is mild. They can just push it in the My Sejahtera, because we also want to know what is the incidence of AEFI, because this is a very new vaccines. We want to know how it goes to how our population react to it. So no reports doesn't mean that it's good, but we are quite curious why these 2 days there is 0 report of AEFI. So please do so.
Okay. So there's no hospitalizations at all, huh?
We had 1 case, reported, but he was well managed and actually survived well.
Oh, all right.
But the person actually has got some underlying problem.
All right. Okay, next one is about how will you be notified about the date and venue of vaccinations. If we cannot make it or miss the date, what do we do? This is regarding the appointment for the vaccine. How will you know? So it's through My Sejahtera?
Yeah, this is through My Sejahtera. That's why we really want everybody to try, activate your My Sejahtera.
So if they miss the date,
they can actually go back to the desk, help desk for My Sejahtera. My Sejahtera website, and also in JKJAV, they have this desk, help desk that everybody can access and put their questions and issues over there.
Okay, noted on that. Next one is about for those above 60 and currently on certain medications, do they have to bring this medication along to inform the health authority when they go for vaccinations?
They do not have to bring the medication, but if they can bring, if they cannot tell what is the medication like, they can just bring their home-based card. Sarawakian is having their card, their card on their own, right? They keep it. So if you cannot tell what you are on, please bring it so that we can, scroll what are you now having.
So they just have to bring their medical cards with them.
Yeah, home-based card.
All right. So next one is about, will the vaccine be the same for dose 1 and dose 2? I believe it's the same.
We are receiving a lot of various vaccine coming in May and June. So far, we received only Sinovac and Pfizer, and we might have some other types coming in. Which actually these are all depending on the supply and approval by our NPRA.
So if the question is for individual first dose and the second dose, we try and make it the same.
Yeah,
that will be the same. We
of
won't mix.
course, scientists now are thinking about mix and match for first and second dose, but I think we haven't reached the stage where we are comfortable with you get first dose Pfizer, second dose Sinovac, for instance. It will be the same maker, same manufacturer vaccine for the individual.
All right. I think the next question is about the Senarai Essential Service di Sarawak. Is it something that any of the speakers can answer? Like sejauh mana tu? Okay, sila senaraikan Essential Service di Sarawak yang mana tersenarai semasa pengumuman PKP di Sarawak dahulu, dan bagi data sejauh mana program vaksin ini dah komplit untuk frontliner dan Essential Service. Kalau boleh ada pula banyak mana sudah disuntik.
Okay, I think I can answer this. Untuk senarai Essential Service di Sarawak, I bet this one is related to the definition of petugas barisan hadapan, is it not? Okay, so the definition of petugas barisan hadapan adalah mengikut Jawatan Kuasa Khas Jaminan Akses Bekalan COVID yang dikeluarkan pada 1 Mac yang mengatakan anggota yang berisiko tinggi untuk mendapat dan menyebarkan jangkitan COVID, iaitu yang terdedah secara langsung kepada individu yang dijangkiti. So they divide the frontliners kepada 2, itu 1 petugas kesihatan, the others is essential, the essential services. So these essential services are those who are adalah anggota yang terlibat dalam agensi pertahanan, anggota keselamatan dan perkhidmatan penting. I can give example like those who are manning the PKRC, okay, the quarantine center, like people in JKM who are handling the food for those who are infected, okay, and then the PBT, the local authority, they are also included in these essential services, okay. And recently they include the MOT, Ministry of Transport, into these essential services. So and so far the one that we have received, we received the list about 34,803, and about 76% we have given the vaccination for non-medical frontliners.
All right, thank you, Dr. Radziah. The next question is regarding this. Dr. Mike Jordan claimed that the objective of the vaccine was to reduce world populations. That Prof, you want to comment on this? He was asking for some verifications on this.
Yeah, I think there are many like this. Like I mentioned earlier, there are many people who have very high professional qualifications as well as in various companies. Because Mark Eden was once working for Pfizer. His contention was that the spike protein that is used in the vaccine also is used in the development of placenta in women. You know, when woman in the womb, in the uterus, when a woman is pregnant, the thing that envelops, that provides supply to the baby is the placenta. And he says that because of this, it will incite a woman who receives this vaccine to develop antibody, which will prevent the formation of a placenta. But there are many other reputable scientists who say that even though that spike protein is shed with the thing that develops the placenta in women, the chance of this happening is very, very low. So there are things. I mean, people like us also very difficult to answer. We need answers from people who know better than those people at the same level, no? But at the end of the day, most of the major scientists will think that this is not so. You have to think that there was another thing that was sent, and it was sent to Facebook, and they say that there are 60 pages of information that says that this is not a pandemic at all. This is made up. Just know that for each of those pages, of those 60 pages, there are thousands of other pages that confirm that this is truly an epidemic, a pandemic, and that has killed a lot of people. So I think I won't pay much attention to that claim, even though he was a former thing about Pfizer. But if you read about him, he has some other extreme views as well. Okay, that's my comment at this point in time.
Yeah. I think the next question I want to take is about the safety of this vaccine for pregnant women and breastfeeding mothers. So is it safe for pregnant women? Your official answer. Breastfeeding mother and pregnant woman, is it safe?
At the moment, yeah. At the moment, both the guidelines for Pfizer, the official guideline says that it is safe.
All right.
Yeah, okay. But not for Sinovac.
Okay, not for Sinovac.
Yeah, Sinovac for pregnant is still do not have data for that safety.
All right. Okay, so we do have a case here that there is a staff who got vaccinated for the first dose, and then he got infected by COVID. So does the staff need to be stopped from taking the second dose as scheduled? So you only take the second dose 6 months later?
This is positive in between doses, right?
Correct.
Yeah. So the official guidelines is already out that it is stated that the person can be given within if he is asymptomatic and is free from COVID symptoms.
Oh, wow. Okay. So what about vaccination for AIDS and HIV patients?
There's no contraindication for that. So
yeah,
they can
in fact, they should be getting, because because
Okay.
their immunity is
welcome.
low and their response may not be as, the antibody response may not be as high as person with full immunity. I mean, the body immunity, but they are the ones who really need it also. So they should get the same with cancer patients.
Yeah.
Good. Okay, I think Dr. Radziah just now mentions about the different types that we are going to get. Maybe Dr. Radziah, maybe you can repeat that, because there's a question about how many types of vaccine will be currently approved for Sarawak.
For Sarawak and for the whole Malaysia, the approved vaccine are Sinovac and Pfizer only at the moment.
Okay.
Yeah, there is no. I mean, we don't have vaccine approval just for Sarawak. We cannot do that. It has to be at national level. So whatever Sarawak use have to be approved by the national authority, the NPRA, the National Pharmaceutical Regulatory Authority.
All right, I think we will take the last questions. I think this last questions is about what the current situations in Sarawak, where we are getting very high cases. So despite the movement control measures, so what do you think?
Yeah, I saw that one just now. I think the question to ask is if we don't do anything, will it get worse or not? I think what we are doing is limiting the number, even though it's shooting up. You imagine that it is very, very difficult because the virus have been in the community and especially in the rural areas, and it's very difficult to control. And a lot of the spikes in the number of cases, if you look at them, are to people meeting together. You imagine that if the virus is there, you wear your mask consistently and correctly, and you wash your hands and you don't touch your face, the chance of you getting the virus is very, very low. The reason people get it is when the mask is removed, when they have sessions where they talk a lot, and maybe in the context of our rural areas during funerals and birthdays, and you're very close together and singing, because singing and talking very loud is definitely shown to spread the virus further. Okay, so that's number one. Number two is I saw that part of the question just now. They said that in spite of us having very strict quarantine,
yes,
this quarantine is necessary for two things. The first thing is that if we look at the percentage of positive cases among those who are quarantined coming into Sarawak, compared to the samples that we take within Sarawak, the percentage of positive among those coming in is much, much higher compared to those who are in Sarawak. And we don't want that to, even if we detect 10 cases through quarantine, is very good already. We're preventing 10 from multiplying, starting a new fire. The other thing is, maybe you have read in the news that the variant from, I think the South African variant is already present in West Malaysia and in Sepang region, which is near the airport region, and so on. So if it comes here, it will be very dangerous for us because it's very difficult for us to keep track of it. Because UNIMAS do carry out some form of sequencing, but it's not in the numbers that we can do in the thousands, for instance. So we don't want to have the variant to come in. Okay. So for those two reasons, I think they are unrelated in the sense that our spike this time is not due to what we call import B, that is from outside Sarawak. It is mainly local, but we still need to maintain the border control. We cannot remove the border control just because we say we already have so many here. What's the use? I think that's not the correct way of thinking about it.
Okay, I think we are running out of time. I think we just want to, I think we would like to invite everybody to take a group photo with us. So if you are able to turn on your videos,
I will.
Turn on your video so that we can take a group photo together for our record. Of course, thank you so much for staying.
Can I call you later?
We take a group photo. So just keep smiling to the camera. We will take snapshots. Thank you so much for staying until the end. And thank you all for your questions as well. Just keep smiling. We will just do the screenshots because there's still quite a number of us, about 200 of us here.
Yeah, just keep smiling. I will take our snapshot. Hold on, yeah. Just keep smiling. Hold on, I have 3 more pages. Okay, done.
Thank you. So to conclude our talk, I would like to once again thank you, our speakers, Professor Datu Andrew, Dr. Radziah, and Haji Aziman for delivering such an insightful and informative talks, presentations for us as well. I believe this has, enlightened many of us and about the importance for us to be vaccinated and for us to do our part as well to control the pandemic. So with that, I thank you all for staying with us, for participating in this brown bag talk as well. So till I see you at our next event. Till then, I think goodbye. Take care. Thank you so much.
Thank you. Bye.
And bye.
Thank you.
Thank you. Stay safe, everyone.
See you. Stay safe.
Stay safe.